C. Virginia Fields, President and CEO of the National Black Leadership Commission on AIDS. We are not addressing the issue of HIV/AIDS as part of comprehensive health education in our schools where we should be discussing this, because that's a major point from my perspective of where we began the discussion on prevention. It's still pretty much taboo. Families, they don't sit down and talk about it to the extent that they should. We're seeing younger people or people at much younger ages, 12, 13, syphilis, chlamydia, gonorrhea. They're not getting it by just sitting on toilets. They're not getting it by just sitting in that classroom, nor sitting on boys' laps. So because we know this, we've got to now address it much more openly. I mean, there's the argument, and I'm sure you've heard it before many times. People say, if you open it up, it's going to encourage them to think about it and perhaps get engaged in sex. The rates of increases of STIs and the increase among the slightly older population of HIV shows that they're already engaged in sex. So the data, the facts, what we know should be sufficient to begin this dialogue, but it isn't. So we've got to do more there. And one of the ways that I think that we can do more, again, is to open up the dialogue, have more voices, and have the voices coming from every possible place you can think of. If you're in a church, they're talking about it. If you're in a school, they're talking about it. If you are in a barber shop, the condoms are there for distribution, and that's going to lead to another level of conversation. If you're at one of your social gatherings, to have the debate and engage more voices in it. I believe that we've got to start bringing some younger people into this fight. They have got to have a clear understanding of what is going on, and I think it's always very helpful when you're hearing your own peers tell the story, you know, as we get older, and they want to say, back in the day, no, this is here, this is now, and it hasn't even reached the time that it's going to affect many of these young people. So listening from their peers about what is happening, we hope will have a greater impact. Telling the story from their perspective, however they will tell it. But it's also bringing into the forefront new faces, new leaders, younger people, because most of the people I meet in this continuing fight over the last 30 years are people who've been in it for 30 years or so. You know, we're all getting older. We're all getting tired. And we need younger people to take on the realms of leadership. As I move around the country and talk to these audiences that we've been talking about now, folks who've not been a part of it, the willingness to listen and say, I had no idea, and move out of that place of complacency and use their organizations and their chapters, whether it's sororities and other civic social organizations, use their organizational structures to be a part of this voice, because they too care. And every time I walk into a space where people have not focused on this, by the end of that conversation, they're asking, what can I do? How can I be a part of the conversation? That gives me hope.